And now we will be discussing the impact of COVID-19 infection on CPVT. The full name for CPVT is catecholaminergic polymorphic ventricular tachycardia, but that's a bit of a mouthful, so let's just stick to CPVT. Now, CPVT is a familial arrhythmia syndrome which is characterized by an increased risk of life threatening arrhythmias during periods of exercise or stress. So, exercise and emotional circumstances can trigger these life threatening arrhythmias. An increase in heart rate alone, for example, caused by fever, is not enough to trigger these arrhythmias. And that's an important point to bear in mind, an important comforting thing for patients with CPVT to consider and bear in mind. Now, none of the specific drugs used for treatment of COVID-19 interact with CPVT. And again, that is a reassuring point. It's very important that if you happen to be on a beta blocker or flecainide for your condition, you continue taking this without fail if you happen to suffer from a COVID-19 infection. Obviously, if your symptoms are bad enough for you to go to hospital, you have to mention to the doctors in A&E that you suffer from CPVT, because some of the drugs that are used for resuscitation, for instance, like epinephrine, adrenaline, should be used with extreme caution in patients with CPVT. But by and large, if you are suffering from CPVT and you happen to have COVID infection, you should do nothing more than just continue your drug therapy, such as beta blockers and or flecainide.